Good evening, everyone, and welcome to today's session. Mansi, Saxena, and many more who are all online. Let's make the great beginning and give that last nail in the coffin of Pediatrics for NEET PG. So please inform your friends to join the live class. I hope a good number of you have finished answering the questions. So please don't forget, before we start the session, we give you a small challenge, a bout of challenge, where you need to answer into the chat window the shower of questions. And after that, Dr. Murali Bharadwaz arrives to carry on the discussion. So let's make the great beginning, Doctor. Now, the most common ASD, this is the favorite area of the examiner. इसके पहले भी बहुत बार डिस्कस किया. Ostium secundum. Whereas in the Down syndrome, what is the most common ASD? Ostium primum is what you should remember. Sitting without the support by 6 months, if the weight of the child is 70% of the normal according to the IAP, how would you like to categorize the malnutrition? It is moderate. So you should be quite sure on this jargon of Indian Association of Pediatrics. More than 80% weight for the age, then you call it as normal. Good to see Dr. Parvez, Mansi, and many more who are all online. Grade 1 is also called mild, is 71 to 80%. Grade 2 is moderate, 61 to 70%. 51 to 60 is severe. Less than 50 is very severe. This is what you have to emphatically remember. Female pseudo-hermaphroditism. Obviously, the congenital adrenal hyperplasia, which is most commonly responsible. So, pseudo-hermaphroditism is genotype of one type and phenotype of opposite type. Influenza vaccine can lead to itching, fever, local swelling, etc., etc. Now they are all using COVID vaccine in America, etc. So some of the people who received the vaccine first dose, they report fever, body pains, chills. But next day morning, everything gone because they're already got that immunotolerance. Very good. Dr. Parvez and many more, please inform all your classmates. Every day 6 p.m. हमको कुछ भी काम नहीं, आपके साथ बैठना और एक 60-70 क्वेश्चंस डिस्कस करना और आपको इंस्पायर करना. खाली एक ही काम हमको आता है और वही काम करेंगे हम. Right? So please don't forget, every day evening 6 p.m. all 365 days. You have Dr. Murali Bharadwaz spending time with your preparation. Component of the TOF, as all of you know very well, pulmonary stenosis, right ventricular hypertrophy, VSD, overriding aorta, etc., etc. Pulmonary plethora, you see it in transposition of great arteries, hypoplastic left heart syndrome, डबल आउटलेट राइट वेंट्रिकल. बट इन एब्स्टेन्स एनोमली क्या होता है? ट्राइकस्पिड लेवल में ब्लॉक होता. सो राइट टू लेफ्ट को ब्लड जाएगा. सो राइट साइड सर्कुलेशन विल हैव डिक्रीज ब्लड फ्लो. दैट्स द रीजन यू हैव पल्मोनरी oligemia whenever there is abstinence anomaly. Hair and syndrome, what does it contain? HYRAN stands for hyperandrogenism, insulin resistance, acanthosis nigricans. And होता है acanthosis nigricans, hair होता है hyperandrogenism, insulin resistance. Similarly, what is Saha syndrome? Seborrhea, acne, hirsutism, alopecia. The combination is called the Saha syndrome. So you have type A insulin resistance. There's a mutation in the gene that codes for the insulin receptors. Severe acanthosis nigricans begins in infancy, early childhood, alopecia, etc., etc. Now, the patient is having pH 7.24, PCO2 80, PaCO2 36, bicarb is only 14. So low bicarb with a pH in acidotic range defines the metabolic acidosis, is what you need to remember. Whenever the baby cries, when you stimulate it, very good. Dr. Parvez, keep punching your answers, doctor, so that what happens is this session become more dynamic, interactive. You enjoy, I enjoy teaching you, right? So when the baby cries when stimulated, good to see Ekta joining the session, very good. So cry when stimulated. So you should know Abgar score batti marna hai, jara bhi wrong nahi karna. If the tone is floppy, respiration is apneic, no response to stimulation, reflex irritability. Good to see Dr. Gurpreet Maninder Singh. Very good. Heart rate is low. Baby cyanotic, pale all over. Then you get 0 Apgar score for it. Heart rate less than 100 is 1 point. 100 to 140 is 2 points. Cry when stimulated will give you 2 points. So inch to inch of this Apgar score by heart for the tomorrow's exam. PDA होता है acyanotic left to right shunt, more common in the preterm babies, is what you should remember. Felty's syndrome has rheumatoid arthritis, splenomegaly, and neutropenia. Where do you give IM injection in a neonate? Thigh is the area. What is the sign of puberty in boys? Puberty in boys is enlargement of testes. Because we reached almost end of the pediatrics. I'm trying to run fast because a good number of these questions are having repetitions, right? Good to see Shiva Kumar, Shiva Puji, very good. Shiva Kumar, you are from which part of the country, Viday? Yes. The most common presentation of Wilms tumor is a symptomatic abdominal mass. When the mother was giving bath to the baby, she found. What is the common cause of congenital stridor, laryngomalacia? How do you make a confirmation of a case of male intersex? Good to see Khan and many more who are all online. So Shiva Kumar, what is your favorite branch? What do you want to become? You want to be a pediatrician, radiologist? What is your dream branch? So male intersex is genetic testing. That is what you need to remember. Post-term baby with tachypnea, what is the commonest cause? Very good, from Karnataka. So finally, Shiva Kumar, you want to be a neurosurgeon, cardiothoracic surgeon, What is your dream branch? In postpartum baby, already we discussed. Taram baby, cesarean section, TTN, transient tachypnea of newborn. Preterm, hyaline membrane disease. Postterm, meconium aspiration. So the major criteria of rheumatic fever: carditis, erythema marginatum, subcutaneous nodules. 0.9% saline में कितना होता है सोडियम? So you can easily remember, doctor. Normal, abnormal, saline. Excellent. MD General Medicine. So you belong to our blood group of MD General Medicine. Very good. So doctor, 154 milliequivalents of sodium. 154 milliequivalents of sodium in 0.9% saline, which is called normal saline. 514 milliequivalents is what you have in 1 liter of 3% saline. Okay. Now, in pellagra, it is the niacin. Right or left-handed? Is it Bumrah or who is the other great? Muttai Muralidharan. How will you decide right or left-handed? It is by the age of 3 years. 3 years will decide right or left-handed. Which drug is used in neonatal resuscitation? Adrenaline, soda bicarb, naloxone. Delayed puberty का definition क्या होता है? Whenever the menarche is beyond 16 years. So you should be very sure. Girls and boys, how do you know that delayed? What is the definition of delayed puberty? Lack of breast development by 13 in girls. More than 5 years between breast growth and menstrual period. Lack of pubic hair by age 14 and failure to menstruate by age 15 to 16. Similarly, boys may, what is the definition of delayed puberty, doctor? If testicular enlargement does not occur by age 14, lack of pubic hair by age 15, more than 5 years to complete genital enlargement, that defines the delayed puberty. Respiratory distress syndrome in the neonate, dipalmitoyl deficiency, functional disorders, fugue, completely forgotten and going around, conversion, hypochondriosis, they're all functional. अभी आ गया थोड़ा discussion का topic. Reye's syndrome, what is wrong? Reye's syndrome में hypoglycemia होता है, elevated transaminases will be there, hepatomegaly will be there. It is associated with salicylate ingestion, same time as that of a viral infection. So, acute non-inflammatory encephalopathy and fatty degenerative liver failure is the Reye's syndrome. Reye's syndrome. So it is a post-infectious triad of clinical features is Reye's. Encephalopathy, fatty liver degeneration, and transaminase elevation. The most common secondary mitochondrial hepatopathy, Reye's syndrome. It is mitochondrial hepatopathy. It affects all organs but mainly brain and liver. It has 0 to 6 stages. Peak incidence is at about 6 years of age. Most cases are between 4 to 12 years. And seasonal relation with influenza and varicella outbreaks is what you need to remember. There are hepatic changes, cerebral changes, renal changes whenever there is Reye's syndrome. Typically, genetically susceptible individuals you see. So here there is a interaction between influenza, varicella, salicylates, etc., etc. So it has a biphasic course, doctor. One is a prodromal febrile illness, resolution of symptoms. Within 5 to 7 days, there is an abrupt onset of a protracted vomiting and neurological impairment. So mild febrile illness, recovered, profuse vomiting, then develops within few days, and encephalopathy accurately is what you need to remember. Shailaja, please, you can always change the settings, doctor. If your internet is not speedy, you can change the settings into a low resolution. Generally, it will automatically reset. But otherwise, this is a HD video. Okay? Now, what are the signs of Reye syndrome? Persistent recurrent vomiting, listlessness, personality change, disorientation, confusion, delirium, convulsions, and loss of consciousness are all the features. In Reye syndrome, the first neurological manifestation is lethargy, followed by irritability, restlessness, delirium, seizures, and coma. And in the children younger than 2 years, it is diarrhea, hyperventilation, which are the first clinical signs. So there is a protracted vomiting, dehydration, hepatomegaly, very important, minimal or absent jaundice. Jaundice is absent. This is the most frequent MCQ asked by the examiner in the tomorrow's exam about the Reye syndrome. So there are 6 stages, where stage 1 usually quite lethargic, sleepy, vomiting, laboratory evidence of liver dysfunction. So there are certain diagnostic criteria for the Reye syndrome. Most important, it is acute non-inflammatory encephalopathy with altered level of consciousness and hepatic dysfunction with liver biopsy. It will show fatty metamorphosis with 3-fold increase of ALT, AST, ammonia, etc., etc. A 3-year-old child comes to the emergency with history of vomiting, loose watery motion for 3 days. The child is drowsy, sunken eyes, hypothermia, skin pinch is taking time to revert back. The other day we have discussed how do you define no dehydration, mild dehydration, severe dehydration. There is nothing like some dehydration, only no, mild and severe, 3 stages. Pediatrics, chronic osteomyelitis, benign giant cell tumor, they are all precancerous. Intrauterine hydronephrosis of 30 to 34 weeks of situation. How do you want to manage? Whenever intrauterine hydronephrosis is there, you should always do the ultrasound and rule out all other associated anomalies. When will a child knows if he's a boy that he's a boy, or if she's a girl that she's a girl? 3 years. Handedness develops by 3 years, and knowing whether I am a boy or a girl will also be known by 3 years. 2 things about 3 years. Golden hair syndrome. भैया golden hair syndrome का दूसरा नाम होता है golden hair Gurlin syndrome. It is also called first arch syndrome, first and second branchial arch syndrome. Problem is first and second branchial arches. How do you recognize? Unilateral facial asymmetry, unilateral external and middle ear changes, vertebral malformations, upper lid coloboma, mildly deformed ears to anosia, external auditory canal atresia, underdevelopment of mandible, orbit, facial muscles, hemifacial macrosomia, etc. So you can see facial asymmetry, doctor. When you look at this half and this half, facial asymmetry. Incomplete cleft lip. Incomplete cleft lip is another important feature of golden horse Gorlin syndrome. SLE is autoimmune. ANA, childhood SLE has a poorer prognosis compared to that of the adult SLE, is what you need to remember. Hemorrhagic disease of the newborn. Early hemorrhagic disease of the newborn, late hemorrhagic disease of the newborn. What are the causes? How do you manage? Everything we discussed. If you missed it, please go back to the earlier videos. So what are all the vitamin K dependent factors, doctor? 2, 7, 9, 10, they're all vitamin K dependent factors. 8-year-old child with hematuria within 5 days after throat infection. What is that called? Synpharyngitic hematuria. Typically is a feature of IgA nephropathy. Hemophilia X. Which hemophilia is X-linked? Both hemophilia A and hemophilia B, both of them are X-linked. Klinefelter is XXY, all of you know. In Kwashiorkor, you have apathy, increased transaminases, flaky paint dermatitis. Already, Kwashiorkor versus marasmus, we already discussed it. Meconium can be passed up to how many days in a healthy baby? For up to 3 days in a healthy baby. Cardiovascular syndrome has sinusitis, bronchiectasis, dilatation, and infertility because of dyskinesia. Ciliary dyskinesia is what you should remember. Osteomyelitis can simulate Ewing sarcoma because Ewing sarcoma is diaphyseal, presents with the raised inflammatory markers, etc., etc. So people often confuse for osteomyelitis. Nephrotic syndrome does not have hematuria, edema, hyperlipidemia, massive proteinuria. अच्छा भैया, हाइपरबिलिरुबिनीमिया का लेवल के हिसाब से आप कितना हो सकता जॉन्डिस बोल सकते क्या? क्यों नहीं? If the face is involved, level of bilirubin is 4 to 6. Chest, upper abdomen 8 to 10. Lower abdomen and thighs 12 to 14. Arms and lower legs 15 to 18. Palms and soles 15 to 20 milligrams per deciliter is what you need to remember. Cardiac topography. What does it depict, doctor? Fetal heart rate monitoring. So 30 to 240 beats per minute, and you compare that with the uterine activity between 0 to 100 millimeters of mercury. What is the most common cardiac defect in Turner? Turner में होता है coarctation of aorta. In Henoch-Conlin Spardaya, it is a benign, recurrent, microscopic hematuria is Henoch-Conlin Spardaya. But a gross hematuria may be seen typically in about 20 to 30% of patients is what you should remember. A child has a lesion on the buttocks since 2 years, spreading peripherally with central scarring. This requires some discussion. What is your diagnosis? Erythema annulae centrifugum. So erythema annulae centrifugum, erythema chronicum migrans, erythema marginatum, gyratum repens, necrolytic migratory erythema, annular erythema of infancy. इतना erythemas है, circular erythemas में, this is how you classify. 1-2 points about each of them. They begin as firm pink papules that expand centrifugally, then develop central clearing. An individual lesion can enlarge to greater than 6 centimeters. And this is how typically the lesion looks like. Any other annular erythema is a differential diagnosis. So this is how erythema annular centrifugum. Erythema annular centrifugum looks like. Whatever. So what is the etiology? Shiva Kumar is asking question, sir. Is it true in adults also for jaundice? No. It is in the newborn baby. Okay? It is in the newborn baby jaundice assessment. So, bacterial infections, viral infections, fungal, parasitic, antimalarials, thiazides, estrogen, cimetidine, SLE, Jogren, anything can lead to erythema annulate centrifugum. Now, there is another entity called annular erythema of infancy. It resembles the erythema annulate centrifugum. And you need to rule out lupus erythematosus and infections. And even Candida albicans colonization in intestine and Epstein-Barr virus infection also associated. So treatment is only wait and watch whenever you see this kind of lesions in the baby. Right, doc? Now, erythema marginatum is also called marginatum rheumaticum. It is the manifestation of acute rheumatic fever. These lesions of acute rheumatic fever are usually asymptomatic over a period of 12 hours, migrate by 2 to 12 millimeters, and erythema migrans, typically you see in Lyme disease, Lyme borreliasis. Typically 7 to 15 days after a tick bite, you get this kind of an annular erythematous block. Then erythema gyratum repens is also called Gemel's disease. It is a paraneoplastic figure 8 erythema. Paraneoplastic figure 8 erythema. So, whenever there is any underlying neoplasia, then this kind of zebra-like pattern is what you get, rings within rings. So 85% of the people who have this erythema gyratum repens have an underlying malignancy, and that lead to paraneoplastic manifestation. So the lung, the breast, the stomach, the esophagus, any malignancy can lead to erythema gyratum repens. And in fact, the cutaneous lesions can develop even 1 year prior to 1 year after the malignancy. Infant is having 1 episode of febrile convulsions, admitted to the hospital. Fever subsided, followed by rash, which is maculopapular erythematous. That is the classical description of chickenpox. It's also called day 1 rash. Day 1 rash. Varicella rash is called day 1 rash. Varicella is a DNA virus, most common in the winter and the spring, is what you need to remember. For the rheumatic fever, subcutaneous nodules is one of the major criteria. Acute malnutrition, wait for height. Kuppuswami's classification of the socio-economic status. What are the criteria? Roti, kapada, makan. So education of the head of the family, occupation of the head of the family, income per month from all sources. Makan ki kiraye, खेती बाड़ी में जितना भी पैसे आए, स्कूल में टीचर काम करने की वजह से जो भी पैसे आ रहे हैं पूरा पैसे इकट्ठा करके कितना है आमदनी, दैट इज अ डिसाइडिंग फैक्टर. A 7-year-old boy ill and has fever, what is the requirement? 1900 kilocalories per day. So a boy doesn't want to speak in the school. He doesn't speak at all in the school, but he has a normal speech at other places. So what is your diagnosis? Selective mutism. Selective mutism is also called elective mutism. Lack of speech in only a particular social situation like Vaivavos. So the ability to speak is very much there in other situations. So there is a DSM-5 criteria for the selective mutism. Kangaroo mother care. So you should know everything about Kangaroo mother care. Kangaroo mother care is the care of the newborns. Skin to skin touch with the mother. The warm skin to skin touch with the mother. It is a powerful method to promote the health of and well-being, especially low birth weight infants weighing below 2,500 grams, preterm infants with gestational age less than 37 weeks, and even in term infants. So in 1979, Dr. Edgar Reye, Hector Martinez, they were working in Bogota, Colombia. They found a large number of LBWs, preterm babies, delivered because of poor antenatal care attendance. There's a lot of shortage of staff. So then they decided a lot of their mothers were abandoning these kids. So then they thought how we can make the mother and the child to live together. So that's how came the Kangaroo mother care. A new baby kangaroo, Joy, is very immature at birth, very small in size. The mother's kangaroo's pouch provides warmth, safety, and constant supply of the food, that is the milk. So similar to the kangaroo's mother is providing the care to kangaroo. These pediatricians, Dr. Edgar Reye and Hector Martinez, decided that why not in human beings? So what are the components of Kangaroo mother care? It is not Kasturba Medical College or Kakatiya Medical College. It is Kangaroo Medical Care. So doctor, skin to skin mother's chest secured with a wrap. So kangaroo position, kangaroo nutrition, kangaroo discharge. So exclusive breastfeeding whenever possible. Kangaroo discharge. Mother continues the KMC practice at home after discharge. Then kangaroo support. So place the baby between the mother's breasts in an upright position. Turn the head to the side in a slightly extended position so that you are keeping the airway open. And this will allow eye-to-eye contact between the mother and the baby. Avoid forward flexion, hyperextension. So this is how the baby stays skin to skin touch with the mother. And tie the binder firmly so that the baby will not slide out. The baby's abdomen should not be constricted. So these are the various types of binders. Then kangaroo nutrition is exclusive breastfeeding. Initially tube or cup feeding before breastfeeding is established. And the mother continues the practice of KMC after the infant is discharged to home. So the mother needs encouragement if she has to give KMC. Teaching mothers that skill to take care of their LBW babies is the most important point in Kangaroo support. So Kangaroo position, Kangaroo nutrition, Kangaroo discharge under a supportive environment are the components of the KMC. The child has a long history of hemoglobin of 5 gram%. So always anemia means you look for the reticount, peripheral smear, complete blood picture, most important investigation. What is the sign of puberty in girls? Thelark, breast bud development. 3-year-old child with normal height for age, abnormal weight for age, and abnormal weight for height. So you must be quite sure what are the parameters for acute malnutrition versus chronic malnutrition. Hypergonadotropic hypogonadism. That means testosterone is low, doctor. But FSH, LH are high. That means pituitary is working okay, but testis has a problem. So that typically happens in Klinefelter syndrome, where testicles undergo hyalinization. Similarly, Swyer syndrome, Turner syndrome, which is a state of gonadal dysgenesis. They're all the examples of hypergonadotropic hypogonadism. In Turner syndrome, what is karyotyping? 45x4. Potter syndrome, what are all the components? Whatever. Very good to see 19 online classmates. Excellent, doctor. So once more, मेरे प्यारे भारतवासियों, I wanted to retell you every day 6 p.m. to 7:30 p.m. Dr. Murali Bharadwaz is all yours, and we give you 50 to 70 MCQs as a PowerPoint quiz, every slide rolling at 12 seconds. So please take chance to do it like an exam situation. After that, Dr. Murali Bharadwaz arrives and we will have a discussion till 7:30. All 365 days across the year. You don't need any other coaching in the world. I become your classmate, roommate, benchmate, study along with you and enjoy the journey along with you, seeing you becoming toppers and sending me a laddu on WhatsApp saying that, sir, I got the top rank. I joined MD Pediatrics. I joined MD General Medicine. I will be looking forward for that. Great news. So please tell your friends also, every day 6 p.m. earthquake ho, tsunami ho, tornado ho, COVID ho, or a new strain of COVID in UK ho, Dr. Murali Bharadwaz will be available for you to do the revision. Live online interactive class. Additionally, we also have 427 hours of video lecture, HD video, 1500 video lectures, plus 30 full-scale grand tests, NEET PG pattern every Sunday, plus 10,000 PowerPoint slides of notes, plus 10,000 MCQs as quiz tournament on Incus app. What more do you require? You have, in addition to around 150 hours of free live online class. So all this is made available for you for a small price of 10,000 rupees. Take every opportunity to call our helpline 9000-868-356. There are so many places you get video lectures, books, MCQs, everything. But what is important is you require an everyday companion to have 1.5 hours of studying together along with you. At least 6 महीने मुरली भरद्वाज के साथ अपना जर्नी लेके जाओ. सीट नहीं मिले तो मेरा नाम मुरली भरद्वाज नहीं है. बराबर? So, what is Potter's syndrome? So, this is very important MCQ in the entrance, doctor. Be very sure. Oligohydramnios. There is a compression of developing fetus, limb deformities, facial anomalies, low set tears, retrognathia, compression of the chest, lack of amniotic fluid, pulmonary hypoplasia, ultimately leading to death. So what is the reason for all this oligohydramnios, etc.? Always oligo or polyhydramnios, what is amniotic fluid? Nothing but a fetal urine. So any fetal renal pathology like ADPKD, obstructive uropathy, partial valves, bilateral renal agenesis, chronic placental insufficiency, anything can lead to Potter's sequence. So the babies who can't pee in utero develop the Potter's syndrome. So pulmonary hypoplasia, oligohydramnios, twisted face, twisted skin, extremity defects, renal failure in utero, they're all responsible for the Potter's sequence. So bilateral renal agenesis, bilateral multicystic, dysplastic kidneys, reduced fetal production, urine production, oligohydramnios, low set tears, weak nose, prominent epicanthic folds, downward slant of the eyes, pulmonary hypoplasia leading to respiratory failure, limb abnormalities. That is the definition of Potter's faces. Which drug do you use in absentious, doctor? Lamotrigine. So you should know what are the various first line, second line drugs in the management of different types of epileptic classes. So once more, in onlineMBBS.com, you have, if you go to the video library, you have in pharmacology, we have 54 video lectures in pharmacology, excellent lectures in HD video. Take every opportunity to do the revision of the anti-epileptic drugs. Most common cause of acquired heart disease in children any day is rheumatic fever. Mildly elevated bilirubin, normal liver enzymes, typically seen in thalassemia, malaria, G6PD deficiency. Single umbilical artery का 4 or 5 causes बताओ. Certain congenital heart diseases. So typically around 0.63% live birth show single umbilical artery. So diabetes, epilepsy, APH, oligohydramnios, hydramnios, chromosomal abnormalities, anything can lead to single umbilical artery is what you should remember. Acute breathlessness. Acute respiratory distress means always look for conditions like pneumothorax. Hypocalcemia in a child, it occurs because in Digeorge syndrome, hypoparathyroidism, magnesium deficiency, anything can lead to it. If the annual parasite index is more than 2, less than 2, what are you going to do in National Malaria Eradication Program? I mean, the modified plan of operation. So the whole idea of MPO is prevent the death due to malaria, reduce the morbidity and retention of all the achievements so far. So based on the annual parasite index, API less than 2, greater than 2. If it is greater than 2, you should start spraying, entomological assessment, surveillance, treatment of cases, decentralize the laboratory services at PHC and establishment of DDCs and FTDs. Drug delivery centers. Female hermaphrodite होता है, phenotypically male but genotypically, but internal organs are ovaries. So what lead to female pseudohermaphroditism? Why the external features become male? Because in spite of having XX and ovary, any excess androgen, like 21 alpha hydroxylase, 11 alpha hydroxylase, 3 beta HSD, aromatase deficiency, etc. etc. Baby is O positive, mother is RH negative, card bilirubin is 7, conjugated 1. So what is the treatment? Stop the breastfeed and start the exchange transfusion. So doctor, what is the indications for exchange transfusion in neonatal jaundice? Serum bilirubin more than 5 milligram per deciliter at birth. And if the serum bilirubin is equal or more than 20 milligram per deciliter in a term baby or 15 milligram per deciliter in a preterm at any time in the first week of life. Similarly, rhesus avivo incompatibility, severe anemia, hydrox fetalis, hyperkalemia, neonatal polycythemia, drug toxicity, any of them are the indications for the exchange transfusion is the favorite question of the examiner. 3 days old newborn with unknown inborn error of metabolism has hyperammonia. Hyperammonia is a feature of urea cycle enzymes. Once more, urea cycle also, early part of the urea cycle enzymes have a greater chance of leading to hyperammonemia than the late parts of the urea cycle. 10-month-old child, what is the language development is the favorite question of the examiner. Remember, doctor, 6 to 11 months understands no and babbles and says mama and dada. 12 to 17 months, vocabulary of 4 to 6 words is something which you should not forget. Vocabulary of 50 words, 18 to 23 months. Child comes with a blood sugar of 32, very low. How do you want to treat? 10% dextrose, 4 ml per kg is considered to be the treatment of choice. Omalizumab, anti-IgE, which we use in asthma, given subcutaneously. So omalizumab, quilizumab, and ligilizumab, they're all anti-IgE which are used in severe asthma for prophylaxis. Pigmentation and growth retardation is a feature of zinc deficiency. Modified zone criteria में carditis chorea erythema marginatum है, polyarthralgia नहीं है, polyarthritis है. That is what examiner is going to test you. Fore milk, hind milk, what is the difference? By a hind milk relieves the hunger, fore milk relieves the thirst. So fore milk quenches the baby's thirst, contains lactose and protein, not high in calories or fat. Whereas hind milk is thick and creamy, high in fat and calories, found near the end of the pumping or nursing session is what you need to remember. 13-year-old female, sudden onset of high-grade fever, delirium, and medial temporal lobe involvement. Always remember, medial temporal lobe involvement is Incus, is an important feature of herpes simplex encephalitis is what you should remember. 100 centimeter height आने के लिए कितना दिन लगेगा? 4.5 years. Leishman is HGPRTase deficiency, hypoxanthine guanine phosphoribosyl transferase deficiency. Average Indian child gets 100 centimeters by 4.5 years. Mental retardation बोलने के लिए delayed milestones, Up to which age? 18 years. 1 day old male baby delivered by cesarean develops a swelling in the back, in the midline. That means meningomyelocele, which is due to folic acid deficiency, all neural tube defects. So, doctor, that brings us to the end of this wonderful evening. Once more, tomorrow at 6 o'clock, हम सब मिलेंगे. 50 more questions are there. वो भी खत्म करेंगे कल को. We will tuck a nail, last nail into the coffin of pediatrics and say goodbye pediatrics. And day after tomorrow onwards, we will start, oh my God, sleep promoting medicine, SPM, PSM, right? So study every day, grow a little bit of confidence every day. आपका नंबर भी आएगा एक दिन, right? So उस एक दिन के ख्वाब देखते हुए आप पढ़ना है, मजे में पढ़ना है, right? So Dr. Murali Bharadwaz will be there with you every day evening 6 p.m. Bring some more friends of you every day. Good night.